I'm making an observation as I'm chatting to you, and I don't know if there's anything to this. I don't want to sit here and diagnose you.
No, please.
But
I'm enjoying it.
I'm watching you right now as we're speaking, and I can see your body language, your movements. You move around a lot.
Yes.
You're moving sideways and you're moving forwards. You're away from the mic, and then 1 second you're staring at the ceiling, but you're chatting. Is that part of it?
Yes, that's part of it. We multitask.
You just did it now.
Yeah, we multitask. We listen to you. And it's not good in marriages because the wife thinks you're not paying attention to her and you're being rude. And we're impulsive, so we tell the wife wherever to get off, And the phone is our addiction. So yes, that totally happened. If you watch me for 1 hour, you'll get it right. So yes. But we always see things before other people see it. It's just that how do we get to it, right? Well done. You can change we need somebody in Melrose House to come work with us.
Okay, 0214460567 011-883-0702. We're taking your calls, and Rob in Four Ways. Good morning to you.
Hi, you Redi? How are you doing?
Fine, thank you. Welcome.
Good, thank you very much. Doc, this is very timeless. You're appearing on the radio, but I'm in a situation where last week I was diagnosed with ADD. I'm 34. I kind of picked it up because I've got a 14-year-old child that has also got it, and my wife said it's like looking at a mirror. And I've been placed onto Strattera, 40 milligrams, I think it is, on a daily basis. My question is, how long do can I expect until this stuff kind of kicks in? I've also been told that there are 2 other medications, and it's kind of a trial and error basis just to see which one works the best.
Okay. You've just started Strattera, correct? And you're only taking Strattera, nothing else?
That's it.
Now, Strattera is a non-stimulant that takes about 2 months to kick in. So many times it appears that it's not working and you need 1.4 to 1.8 milligram per kg. So slowly it will be taken up. In North America, if you draw a pie, 50% of the patients are taking stimulants, 30% are taking a combination of Strattera and stimulants, and 20% are taking Strattera alone. So because they can't wait so long and they get a bit restless, so sometimes you have to add a stimulant, Concerta, Ritalin, whatever you like. So combination does a little better than Strattera alone. And as I said, it takes about 6 to 8 weeks to kick in, so by that time you think nothing is working, you can get very frustrated. So that's what's happening.
All right, Rob, does that give you some clarity?
Yeah, it does. So I should wait another 6 or 8 weeks before I expect anything to.
Yeah, you can do all the holistic treatment. We're going to talk about it later on. What the other things with medication that will increase your dopamine and your noradrenaline, like exercise and meditation, and stay away from coffee, chocolate, Red Bull, abuse of alcohol and drugs and smoking. All those type of things. You could do that. The holistic treatment is ultra important, and consider coaching if you have difficulty, but we'll get to it later.
Okay. Is it Desi in Cape Town? Hi.
Hi, good morning. I'm phoning to say that I discovered of late, because I teach at a school, and sitting in the staff room hearing the other teachers speak about pupils and their problems with concentration and ADHD, as it's now called, I realized that my checkered school career and my choices in life were very much based on the fact that I was that way. I haven't gone to a psychiatrist or psychologist and been diagnosed. I am on an antidepressant, which has definitely given me a bit more stillness within myself to actually weigh a situation up before jumping in feet first or head first. Because I was very impulsive, made plenty of mistakes in my life. I think I could have conducted my life with a lot more, stillness, if they looked at things and made some more rational decisions before launching into them. At school, I was always in trouble. Not that I couldn't, I was bright, but it took me a little bit longer, especially the way they taught, because I'm 58 now, especially the way that they taught us in those days at school. It was so bland, and so, today you have so many different visual stimulants, visual things that actually stick in your mind, and in those days they read from a textbook, and if you didn't understand, you didn't understand, and if your hand was up because it didn't sink in, you were in trouble, and I was always in trouble, and I think I was a nightmare to the teachers at the school that I went to.
Okay, Daisy, can I just interrupt you?
Yes.
You said you've never been diagnosed. Why is that?
Well, because I've really looked very hard at myself, and I think I know myself, and I don't know. I think up until now I didn't think that I needed any other sort of medication other than something that would just sort of still me enough to, you know, to be a little bit.
But you believe you've got ADHD?
Yes, because every symptom that's been discussed and everything that I've read pertains to me.
Okay, Doc?
Yeah, well, the thing is, at this age it's not hopeless. We got patients from 4 to 84, and we can still bring out the magic in you and tighten the brakes. As we tell the little boys, you have a Ferrari brain and bicycle brakes, and we are brake specialists, so we can fix that up. The other thing is the antidepressant you're taking. Which one are you taking, dear?
What are you taking, Daisy?
Nuzak, N-U-Z-A-K.
Yeah. Now, the problem in ADHD, there's a low level of dopamine and noradrenaline. Dopamine is for focus, and the noradrenaline is the brakes of the Ferrari, so that you're less impulsive. The Nuzak is good, but Nuzak works on serotonin. We don't really need much serotonin, so it's not the best choice. It's a good choice. And then it won't fix all the symptoms. So every patient has a different difficulty. Some people have a temper, some people have difficulty with focusing, some people have difficulty with having a problem with executive functions like procrastination, organization, time management, those things. So you've got to see which are your symptoms, and then it's important to consider coaching. It's ultra important. Exercise is right up there, and then as time goes along, you'll see where you still have difficulty, and the medication can be changed. Usually it's polypharmacy. No one medication is going to do the magic, so you'll need to add a few different things. And stimulants, if you're on stimulants, they don't do everything as far as depression does, and the antidepressant doesn't give you super focus, so you'll have to put the whole potpourri together. But it should be treated. We have great treatment. The success rate is very high. And you said, sure, you said you were very bright. I expect you to be bright because all ADHD are normal and high IQ.
Does she sound like she's got ADHD though, even though she hasn't been diagnosed, well, from what you've heard?
Yeah, most times the symptoms, yes, it looks very close to what we do, and most times it's exactly where the direction is right. Most parents get it right from the kids or from the internet and that. But we have to see which areas of your life you are struggling. Are you getting depressed? Are you getting anxious? Does it affect your relationship? Does it affect your work? And if you had a checkered career in that would be ADHD would be right up there. And we need to tighten up on your non-medication treatment and also your medication treatment.
Which is the most important? I mean, at which point do you administer medication? Which do you start with?
Okay. It's like there's mild, moderate, and severe ADHD. If the ADHD affects any of these three areas of your life, in an adult, if it affects your marriage or at home, if it affects your friendship or your work life, when there's impairment and you cannot reach your target or whatever you want to do, then you've got to take out the weapons. When it's mild and doesn't affect any of your areas of your life, then omegas and diet and coaching and exercise is tremendous. You still have to do all of that if you're going to add medication. Once you decide on medication, we do a lot of rating scales. We find out if the patient has problem with focusing, then we consider stimulants. We use all the stimulants of children's stimulants like Ritalin, Concerta. We use them all in adults, and so we consider stimulants. If it's mild, we might add an antidepressant that works both on ADHD and depression, like Wellbutrin is an excellent one. It's a superior choice. And then if you have, depending on the symptom, that's how we change the medication. But we use medications in all ages. We use medication as polypharmacy, and it's not either or. It's medication and other treatment. It's not which is better. It's holistic. We need all of it together.